It appears the overwhelming challenges we faced during the peak of the coronavirus pandemic needed unconventional solutions. Among the challenges were inadequate health facilities to manage COVID-19 cases, insufficient health personnel to assist infected persons, and the capacity to produce a vaccine. Government has so far spent over 19 billion cedis on the fight against the COVID-19 pandemic. This includes the provision of free water and electricity, the production of over 14 million pieces of PPE, the construction of health facilities across the country, and the latest initiative, the acquisition of COVID-19 vaccines. Clearly, government needed money for such an endeavor, but it is time to collectively settle the debt. The COVID-19 health levy, a 1% point increase in the national health insurance levy, and a 1% point increase in the value-added tax flat rate is to support expenditure related to COVID-19. It will largely be directed at the efficient performance of the health sector. The levy will also help mobilize additional revenue to employ more health workers at the country's health facilities, build new health facilities, and finance the deployment of COVID-19 vaccines across the country. Though this is a good initiative to help win the fight against COVID-19, there are issues that need to be addressed.
I was excited to hear about the levy, but I'm wondering why they decided to call it COVID-19 levy. Because if you call it COVID-19 levy, then it gives a certain assumption that this is a levy which is temporal. And so after we've been able to clear the COVID-19 related debts, then it should go off. But I think that this is a fine opportunity for government to be bold and call this a health levy, so that it goes to add to the already existing levy for health insurance. Because mind you, both the government and the opposition had proposals in their manifesto to really connect preventive care to our health system and ensure that the NHIS funds it.
A cross-section of the public who will soon be paying the levy has concerns.
To be honest with you, I don't think it's a bad thing yet, but in quotes, those who are going to manage the fund, how they are going to manage it so that the citizens will benefit from it, that's the one thing.
It's a very good idea, but the timing, I'm thinking the timing, because we are still in the pandemic. The problem is still there. Everybody is sacrificing, especially the frontline health workers. So I was thinking the government officials should also sacrifice for the people.
Judging from the fact that Ghanaians and even the whole world have been saddled with the problem of COVID-19, and it is worrying. It is a very serious pandemic. So I think the introduction of this levy will help the government to curb the menace.
The purpose of the levy or the tax is good, but then some people might not be able to, the ordinary Ghanaians, it might be, very difficult for them to, cope with that. So I was thinking maybe the consumption of some, should I put luxurious products like alcohol and even sporting bets, people are making money out of that. So yeah, we can channel that, we can use that avenue to get that money instead of, taxing everybody.
The levy is a component of the National Health Insurance Levy, which is managed by the NHIA, and the authority itself has financial difficulties in recent times, such as the misappropriation of funds and late settlement of claims. Are there lessons to be drawn from the NHIA experience, and how prudent are we going to manage the funds?
My problem is more of the fact that the money would actually come back to health. And again, I also think that this should have been money that goes directly into the NHIS fund, and from there is administered, into the health system. It's one thing for us to talk about collecting funds, but it is also another thing for the funds to be released. Because let's ask ourselves, the already existing levies, it's collected, so how come that it delays? The problem we have right now with our budget is that there is less fiscal space for the Minister of Finance to be able to maneuver.